Hello all. Today we will be discussing an ECG of a tachycardia. We can see that this is a pretty regular tachycardia that is going on. Now the first question that arises in mind is this a broad complex tachycardia or a narrow complex tachycardia? Well, we can see that this is a broad complex tachycardia. Now we can obviously see that the QRS width is pretty broad. So there are two possibilities for having this broad complex tachycardia, and these are the most important to be ruled out. One is the supraventricular tachycardia with aberrancy, and the other is the ventricular tachycardia. Now we know that the management of these two tachycardia are different, so we need to be sure before managing these. First question that arises when we are labeling a tachycardia as a broad complex tachycardia is the QRS the width. Now, the QRS width of this tachycardia was 140 milliseconds. So, for a normal QRS, it has to be 110 or 120 milliseconds. So, it's a bit higher width as compared to the normal. That's what it categorized to be a broad QRS. Now, we know that the more the width of the tachycardia, the more the likely chances of having it to be ventricular tachycardia. The width in this case is not pretty high, which kinds of makes the SVT unlikely. So it's still in the differential. Now let's move forward. The next question that arises is the concordance. So what do you mean by concordance? This means that looking at the QRS complexes in the chest leads from V1 to V6, we have to see whether the QRS complexes all look like the same or they all have the same direction. So for instance, if it's a positive concordance, this means all the QRS complexes has to be positive from V1 to V6. In this case, we can only see the positivity in V3 to V6 and the V1, V2 are negative. So this is not a positive concordance. For a negative concordance, it has to be all negative QRS complexes and which are only present in V1 and V2 while the rest have positivity. So this means that there is no concordance, either positive or negative. So whenever there is no concordance, this again goes in the favor of SVT with aberrancy, although it still doesn't rules out the ventricular tachycardia. Now let's move forward. The next question is that is there an absence of RS complex in chest leads? So this again goes back to the concept of concordance. So we already have shown that there is no absence of RS complex in all chest leads. So there is a positivity in few of the leads. Okay. So there is no absence of RS in the chest leads. So by this now we means that we can see an RS. This is a pretty small R and a deep S in the lead V1. So now let's have a cross look on this V1 lead. So I have zoomed in now the V1 lead and we can see that there is a small R and a deep S. So when there is no absence of an RS and a presence of RS, next we have to see the width of this RS. So the width of the RS complex in lead V1 has to be more than 70 to make it to the ventricular tachycardia. So now in this case I have marked them from here to here this RS interval duration in V1 and it was calculated to be around 60 milliseconds. So this means that it is also not broad enough to favor VT. So far we can see that majority of the findings are not favoring VT, but this still doesn't rule out a ventricular tachycardia. The next most important question is there any VA dissociation? So what does this means? This means that in the tachycardia, if we can see that there are more V's than A's, then it is almost the diagnosis of ventricular tachycardia and SVT is kind of ruled out. So whenever we see this, we should not miss this. So let's have a look on the ECG first. So here we can see that there are obviously very clear QRS complexes, and it's pretty hard to find the VA dissociation. Now the thing is that since the P waves are small, then you have to look very carefully in some humps and bumps in between the QRS complexes. So I have managed to see few of these, and I have highlighted them for you here as well. So here you can see there are arrows being pointing towards some structure. So what are these? So and these are not regularly seen. We can clearly see that in between the QRS complexes which are not marked by the arrows. So these humps are definitely something which need to be seen and evaluated, and these are the P waves. So we can see that there are few P waves and more R waves. So this is what VA dissociation means. So whenever we can find this feature in the ECG, then this is almost always a ventricular tachycardia. So this is, although a difficult finding to look for and diagnose, but it almost helps you in ruling out a supraventricular tachycardia. This finding is unfortunately seen in only 5 to 10% of the cases when we see them in the clinical practice. So don't miss this VA dissociation. So summarizing all these findings, we can see that majority of the findings were not in the favor of ventricular tachycardia, but following the algorithm and picking up the important point of VA dissociation, this patient was having a case of a ventricular tachycardia.